Okay, so I just wanted to recap everything we talked about this morning. So, when I evaluated your hip and we were looking at range of motion, originally on your right leg, you had a much harder time when I was rotating it externally. So, I wanted to show you the muscles that actually would be limiting that. So, we talked about your tensor fasciae lata, one of the muscles that feeds right into your IT band. So again, that is this one. So if you have your hand on your hip and you kind of rotate your leg in, you should feel that one pop up against your hand. So the easiest way to kind of test that is you can do it with your knee bent or with your knee straight. It does this motion though, okay? So it's actually going to be rotating your leg in, which you had no problem with. You actually disliked the opposite direction, meaning if this muscle is too tight, it would be stretched going the opposite direction. So then the other one that I wanted to talk about that feeds right into it, your glute med sits underneath your glute max and your tensor fasciae lata, but your glute max actually feeds right here into the IT band also. You use your glute max and your hip flexors, your TFL, constantly on the bike. So this muscle right here would actually rotate you out also. Rotating in, you were not very tight with that one, but that's actually where you felt it more with the ball. And then your glute med is up here. And the glute med also would resist you rotating your leg out a little bit, depending on the position of it. So I just wanted to show you those and remind you how they feed right into your IT band. So the IT band, like I said, you cannot stretch it, change it, whatever, but what you can do is affect the muscles that attach right into it. So that's why we're working on glutes, working on your tensor fasciae lata, because most of your pain was kind of right along the IT band. Again, these are not always exactly what's happening, but that is how it kind of would make sense in my mind. So when I needled you down your IT band, I needled you into your TFL, and I needled you into glute med and glute max.